Have you ever wondered about the common misconceptions surrounding radiotherapy for cancer treatment? It's time to clear the air and separate fact from fiction. One of the most prevalent myths is that radiotherapy is always painful. In reality, the treatment itself is painless, much like having an X-ray. You don't feel it happening, though some discomfort may arise from the position you need to maintain during treatment. Another common misconception is that radiotherapy causes severe side effects. While it's true that side effects can occur, they are usually localized to the treatment area and can be managed effectively with the help of a dedicated healthcare team. Perhaps the most damaging myth is the belief that radiotherapy is the last resort in cancer treatment. This couldn't be further from the truth. In many cases, radiotherapy is used as a first-line treatment and can be curative or palliative depending on the type and stage of cancer. There's also a misconception that radiotherapy makes you radioactive. Rest assured, this is not the case. External beam radiotherapy doesn't make you radioactive, and you can safely interact with others, including children and pregnant women, without any risk of radiation exposure. So, as you can see, many of the fears surrounding radiotherapy are based on misconceptions. Let's delve deeper into what radiotherapy really entails. Now that we've debunked some myths about radiotherapy, it's time to understand the actual process. Radiotherapy is a journey, and like any journey, it starts with a step, the initial consultation. This is where you meet your radiation oncologist, a specialist trained in treating cancer with radiation. During this meeting, you'll discuss your medical history, undergo a physical examination, and possibly have some imaging tests. Your doctor uses this information to make an informed decision about whether radiotherapy is right for you. Once you've decided to proceed with radiotherapy, the next stage is planning your treatment. This involves a procedure called a simulation, which is basically a fancy way of saying practice run. You'll be positioned on a table exactly as you will be during actual treatment, and images will be taken to determine the precise location, shape, and size of the area to be treated. Now let's talk about the treatment sessions themselves. Each session is short and painless, typically lasting about 15 minutes. You'll lie on the treatment table while the machine, called a linear accelerator, directs high-energy rays at your cancer. Here's the cool part. The machine can move around you, delivering the radiation from different angles to precisely target the cancer, while avoiding healthy tissues as much as possible. You might be wondering, how many sessions will I need? Well, that depends on the type and stage of your cancer, as well as your overall health. Some people have treatment every weekday for several weeks, while others might only need a couple of sessions. Your doctor will discuss this with you and tailor a plan to your individual needs. After your treatment course is complete, you'll have follow-up appointments with your radiation oncologist to monitor your progress and manage any side effects. It's important to remember that everyone's experience with radiotherapy is unique. Some people might feel tired or experience skin changes, while others have few or no side effects at all. Throughout this journey, don't forget that you're not alone. You have a team of healthcare professionals by your side, ready to support you every step of the way. They're there to answer your questions, address your concerns, and help you manage any side effects. That's a simplified overview of the process of radiotherapy. Remember, the aim is to target cancer cells while minimizing harm to healthy tissues. Once you've completed your radiotherapy sessions, what should you expect? This question is likely to linger in your mind. Let's delve into that. The aftermath of radiotherapy can bring about a mixed bag of experiences. It's important to understand that side effects are a part of the process, and they vary significantly from one person to another. Some may experience fatigue, skin changes, or loss of appetite, while others may have difficulty swallowing or experience changes in taste. But here's the silver lining. These side effects usually improve over time. Your healthcare team will guide you on managing them effectively. It's crucial to communicate openly about any discomfort you might be encountering. This can help them adjust your treatment plan if needed, and provide targeted advice to alleviate your symptoms. In the weeks and months following your treatment, follow-up appointments will become a regular feature. These are not just routine checkups. They are your safety net, ensuring that your recovery is on track and addressing any lingering side effects or new symptoms that may arise. Post-radiotherapy, your lifestyle choices can significantly impact your recovery. A balanced diet, regular exercise, adequate rest, and good hydration are the cornerstones of your health. Remember, you are not alone in this journey. Reach out to support groups and counseling services if you need to talk or share your experiences. Remember, recovery takes time, and it's important to take care of your physical and mental health after treatment. The journey may be tough, but remember, you are tougher. Let's summarize what we've learned about radiotherapy. As we've discussed, radiotherapy is an invaluable tool in the fight against cancer. Far from the monster it's often made out to be, it's a precise and controlled treatment method designed to target and destroy cancer cells while sparing as much healthy tissue as possible. We've also demystified the process of radiotherapy. We've seen that it's not a one-size-fits-all treatment, but rather a highly individualized one, tailored to the specific needs of each patient. From the initial planning stages to the actual treatment sessions and the follow-up care, every step is carefully considered and monitored by a team of dedicated healthcare professionals. Moreover, we've explored the aftermath of radiotherapy. While it's true that the treatment can cause side effects, these are typically manageable and temporary. It's also important to remember that the goal of radiotherapy is to save lives by eliminating cancer. One crucial takeaway from our discussion is the importance of open communication with your healthcare providers. They are there to guide you, answer your questions, and alleviate your concerns. So don't hesitate to reach out to them. Lastly, we've emphasized the role of radiotherapy in cancer treatment. It can be used alone or in combination with other treatments such as surgery or chemotherapy, depending on the type and stage of cancer. We hope this video has helped clarify some misconceptions about radiotherapy and given you a clearer understanding of its role in cancer treatment.